On 13th March 2020, Kenya confirmed her first case of COVID-19 in a traveller who had arrived from London a week earlier.
Nobody knew what the disease was. Nobody understood it. Nobody had any idea where it was going to take us.
What followed next was panic, fear and confusion. Hospitals were overstretched as patients grappled for oxygen.
When it comes to issues of isolation, where are we going to isolate people? Which what capacity did we have? We had zero.
All that. Some died at home as hospital visits were restricted. But all that changed in March 2022 when the Ministry of Health lifted all COVID-19 restrictions, including wearing of masks, restrictions on large crowd gatherings, and quarantine measures for confirmed COVID-19 cases. It is against this backdrop that global health leaders have warned countries that weak health systems could come crashing in the event of a global pandemic.
At any time, anything can happen, and we don't know which side it's going to come from.
The World Health Organization says the neglect of primary health care in favor of high-tech tertiary services claimed thousands of lives during the COVID pandemic.
High-income countries were surprised because their investments in the last many decades was on high-tech technology, even robotic surgery. But their investment in primary healthcare was not there. Even some countries couldn't do contact tracing.
WHO's Director General Dr. Tedros Ghebreyesus stresses the importance of investing in medical infrastructure, human resources, and public health education.
How can you have a system that can expand when the need comes? This, whatever disease, you should prepare for it. You don't need to know that disease.
In the UK, it is estimated that 1 million cancer cases were not diagnosed during COVID, just because of lack of resources.
The focus is now on middle-income countries to enable them participate in vaccine production. Kenya, for instance, is establishing in-country capacities in the manufacturing of vaccines and other biopharmaceuticals, including the establishment of the Kenya Biovax Institute manufacturing facility.
The COVID-19 pandemic demonstrated the negative impacts of exaggerated high cost of essential supplies and commodities, artificial shortages, prolonged lead times due to vaccine nationalism.
Experts have also proposed integrating artificial intelligence technology to address non-communicable diseases, saying the health systems cannot operate at capacity at present.
We can scan 3 times as many patients if you use AI now on an MRI. We can actually predict within 24 hours, even within 2 weeks, if a cardiac arrest will happen.
Ultimately, global health leaders aim to establish a resilient system capable of absorbing the impact of future pandemics and reducing mass mortalities. Ben Kerera, K24, Nairobi.